Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Centre, Pune, Pune. Today, we are going to talk about a very interesting topic in IVF. Why is IVF so costly? It is a very common question that the couples come to us, ask us that, Doctor, we've understood what technology we are using, but is this so costly, or why is it so costly? And today I'm here to answer this question in a very scientific manner. Now, what happens is, people who cannot conceive naturally come to us for assisted reproduction technologies. There are around 6 to 7 methods in test tube baby technology. The basics starting from IVF and then proceeding towards ICSI, which uses a robotic micromanipulation system. Then if we have to culture the babies, we culture them for the next 5 to 6 days till a blastocyst is formed. Then the freezing is involved and followed by the embryo transfer. So if we have to analyze or critically evaluate the cost behind the test tube baby technology, the basic structure remains the same, which means that whenever a patient comes to us, we analyze what is the lady's reproductive capacity in the form of her AMH and AFC, as we have previously discussed, and we start artificial injections in the form of recombinant FSH or human menopausal gonadotropin injections to the patient are given from first day for the next 10 to 12 days of her cycle. These injections are come in various shapes and various companies are available, but the most important which needs to be selected is the best efficacy, the best safety and painless. So if we have to go for the best technology in injections, it obviously comes at a greater cost as compared to your painful injections. So this is something which you have to understand, that if you have to have painless injections which are best in efficacy, it is definitely going to be more expensive than the routine injections. Apart from this, when the patient undergoes a surgery, the ovum pickup is done, in which the eggs are taken out of her body. At the same time, the husband's sperm is obtained, and we use a robotic micromanipulation system machine with the help of a laser assisted technology to make a child. This particular machine is of a patented technology, and it is definitely an expensive mechanism to make a child, to improve the success rates from a basic IVF technology. Now, after the baby is made, for the next 4 to 5 days, the baby is cultured artificially in instrumentation which is known as the incubators, which are having a similar temperature, pH, carbon dioxide content, all in all atmosphere like a human uterus. Now, this particular machine has to be absolutely standardized, and it has to contain the best possible media and disposables. Now, whenever a baby is born, we are so concerned about the nutrition of the born child, about whether he eats well, he gets good amount of nutrition, good amount of food. So, it is extremely important that when we have made your child, for the next 5 days, when we are responsible to take care of the growth of the baby outside the uterus, it is extremely important to use best quality nutrition in the form of best quality media and disposables, which is obviously comes at a cost, because in these kind of disposables, the best quality disposables are still from abroad. Most of the companies are patented, and we use the best quality technology to give the optimum amount of nutrition for the child. Once the child is born, if we go ahead for a frozen embryo transfer, the cost of the freezing and thawing as well as the embryo transfer needs to add up to your IVF cycle. So all in all, is it so that all types of test tube babies are always that costly? No, not at all. It depends on what is your egg capacity and the sperm capacity. So if the patient's reproductive statistics are good, that means she will require a lesser help from as an assistant, so a basic IVF would do. However, if their reproductive capacity is very low, then the best quality technology is extremely important to be able to give them the child in the first cycle. Thank you so much.